Hello everyone, my name is Anwar Khan and I'm a third year medical student at Florida State University College of Medicine. Today I will be presenting a positive gallium-68 dotatate scan for pancreatic metastasis of renal cell carcinoma in a patient with von Hippel-Lindau disease. The authors for this poster are myself, Arman Sobhan, Mohammad Hamadeh, and Azim Arif. The institutions we're affiliated with are Florida State University College of Medicine and the University of Miami-Jackson Health System. So Von Hippel-Lindau disease, it is an autosomal dominant neurocutaneous syndrome with a propensity to form benign and malignant neoplasms, including clear cell renal cell carcinoma and neuroendocrine tumors. Differentiating metastatic renal cell carcinoma from neuroendocrine tumors in a patient with a prior history of renal cell carcinoma is essential in determining treatment strategies and prognoses. The recent discovery of somatostatin receptors, specifically SSTR2, on clear cell renal cell carcinoma introduces another diagnostic approach using gallium-68 dotatate PET-CT scan in determining possible renal cell metastases and recurrences. So we had a patient come in. She was a 65-year-old female with an extensive history of von Hippel-Lindau disease. She had a total right nephrectomy, partial left nephrectomy secondary to her renal cell carcinoma, and pancreatic cyst. She presented to the clinic with right-sided abdominal discomfort. She expressed signs of her von Hippel-Lindau disease, including her renal cell carcinoma. She had a history of spinal hemangioblastomas, and she had pancreatic cystic lesions. Initially, we got an MRI of her, and we saw these cystic lesions on her pancreas that measured 0.4 centimeters by 0.7 centimeters, and they was initially suspected to be neuroendocrine tumors. A CT scan of the abdomen showed the mass at 3.3 centimeters by 1.6 centimeters at the head of the pancreas. A gallium-68 dotatate PET-CT scan had a radiotracer uptake of the same mass, all pointing towards a neuroendocrine tumor. Endoscopic ultrasound biopsy was performed and surprisingly yielded a metastatic renal cell carcinoma with immunohistochemical analyses positive for PAX8, CD10, and CA9 receptors. In image 1 and 2, this is an axial CT scan of the abdomen demonstrating a heterogeneously enhancing mass at the head of the pancreas measuring 3.3 by 1.6 centimeters. In image 3, you can see a coronal CT scan of the abdomen demonstrating the same enhancing mass at the head of the pancreas measuring 3.8 centimeters in the craniocaudal dimension. In image 4 and 5, this is the gallium-68 dotatate scan where you can see avid radiotracer uptake in the region of the pancreatic head and the uncinate process. In image 5, again, you can see the gallium-68 dotatate PET scan demonstrating an increased uptake of the radiotracer substance in the left kidney. So if a gallium-68 dotatate scan is normally used to detect neuroendocrine tumors because they have somatostatin receptors, but it's not exclusively specific since somatostatin receptors have been found in other tumors, specifically renal cell carcinoma. The traditional method for staging and surveillance of renal cell carcinoma is CT and MRI, but recent studies suggest that up to 75% of clear cell renal cell carcinoma have SSTR2 or basically somatostatin receptors, and that gallium-68 dotatate PET-CT scan can have a 90% sensitivity in detecting clear cell renal cell carcinoma, making it a better diagnostic test than the fluorodeoxyglucose PET scan. In conclusion, this case was complicated by the fact that this patient had von Hippel-Lindau disease, which made her both susceptible to neuroendocrine tumors and renal cell carcinoma, because when we saw the tumors at the head of the pancreas, the initial suspicion was that she had a neuroendocrine tumor as a secondary to her von Hippel-Lindau disease. But clinicians should be aware of the fact that clear cell renal cell carcinoma can also express with somatostatin receptors, allowing it to glow under the dotatate scan. The diagnostic utility of performing gallium-68 dotatate scan to diagnose metastatic or recurrent renal cell carcinoma is understudied and widely unknown, and important features to consider are highlighted in this study. Thank you very much.